Hi, I'm Dr. Dan Lieberman. I'm a psychiatrist, a clinical professor of psychiatry, and the SVP of Mental Health at Hims & Hers. Panic attacks are characterized by a sudden rush of fear and discomfort, accompanied by pretty intense physical symptoms. It can be so intense that in many cases, people think they're having a heart attack and often get diagnosed with panic disorder as a result of going to the emergency room and finding there's nothing wrong at all with their heart. Panic attacks aren't rare. People with no mental illness at all can sometimes have them if they're in a very uncomfortable situation. For example, if they're getting claustrophobic in an extremely confined situation, or something's happening that feels very threatening. Now, panic disorder, which is a mental illness, is different. With panic disorder, the panic attacks come out of the blue, sometimes for no apparent reason at all. They happen so unexpectedly, sometimes they wake people up in the middle of the night while they're asleep. If somebody wakes up in the middle of the night with a panic attack, that almost makes the diagnosis of panic disorder right then and there. Gender doesn't affect the symptoms of a panic attack, but women are about twice as likely to experience panic disorder as men are. The good news, though, is that panic disorder does respond very well to treatment, so it's worth talking to a provider to find out what treatment's going to be best for you. When people experience a panic attack, they may have symptoms such as chest pain, difficulty breathing, hot flashes, trembling, nausea. There are a lot of different symptoms people can have, and no two panic attacks are the same. The bottom line is that they are very, very frightening, but it's important to remember that nothing terrible is going to happen. From a physical point of view, they are harmless. What you want to do is try to ground yourself in the present moment. And focusing on the input from your senses is often the most useful. Pay attention to what you're seeing, hearing, look for any scents in the air, and most particularly, focus on your sense of touch. Feel the ground beneath your feet, feel the clothes against your body. These can help center you, ground you, get you through those 10 or 20 minutes that a panic attack will last. Panic attacks, fortunately, respond well to treatment. So the most important thing to do is talk to a provider about what kind of treatment is best for you. Sometimes it's psychotherapy, sometimes it's treatment with medications. Everybody's going to be different, but the most important thing to know is relief is possible. You just need to go out and find it. We don't know a lot about the causes of any psychiatric illness, including panic disorder. We generally believe there are three broad categories, though. The first is genetics. There does seem to be a genetic component to panic disorder because we sometimes see it running in families. The second component is early childhood. It seems that the experiences people have when they're very young can have long-term effects on their mental health throughout their life. And finally, there's current environment. If you are in a very stressful environment, one in which you might be subject to abuse, that's going to put you at higher risk for having any mental illness, including panic attacks. Do you have any questions about panic attacks? Drop them in the comments and I'll do my best to answer them. And don't forget to subscribe so you don't miss a single episode about mental health topics and how to feel your best.